Having healthy teeth and healthy gums is really important to the overall health of your pet. 70% of cats and 80% of dogs over 3 have dental disease. Having a healthy mouth can extend their life. What we find is that about 60% of dental disease occurs under the gum line, where it's not visible to us during a regular exam. That's why it's really important to do an oral exam while they're sedated. It would be very nice if they could just come in and sit back and let us take x-rays and probe and examine every tooth, but that doesn't work. So they do have to be under general anesthesia. It allows us to look at each individual tooth. We look at the health of the bone and the gum underneath. We look for abscesses and broken teeth. And it's important to find those things because they cause chronic pain in our pets, but our pets can't point and say, I have a toothache, this hurts. So we have to look and determine those things while they're sleeping. We start by placing an IV catheter, and that allows us to give the medications. They don't feel anything once the catheter is in. It also is much safer for your pet. So we administer the anesthesia, and once they're completely asleep and unaware, we start the actual cleaning procedure. We clean and polish every tooth. We examine every tooth. We look for pockets. We look for chips on the tooth, broken teeth. And then we take full mouth x-rays. We take an x-ray of every single tooth and we examine the health of the bone around the tooth and the root of the tooth itself. A doctor will examine the oral cavity. This is really the only time that we are able to see the back of the throat, underneath the tongue, all of the gums. The cleaning procedure itself is very similar to what your dental hygienist would do. We clean with an ultrasonic cleaner, so that removes all of that cemented on tartar, which is really bacteria on the teeth. And it allows us to clean the tooth surface as well as under the gum line where the disease starts. Once we have cleaned each tooth, we polish the tooth, we take the x-rays. The dental x-rays are a really important part of the dental procedure because it allows us to look under the gum line, to look at the health of the bone and the tooth itself. And in that is where 60% of the disease is. It's where the disease starts. So I think of it as an iceberg. The tooth that you can see is just the tip of the iceberg and everything else is under the gum line or under the water. So once we have completed the dental cleaning, we allow the patients to wake up, and it's really very quick. They wake up within 20 minutes or so. We let them sleep for a few hours in the afternoon, and then we typically send them home shortly after that. They're a little bit groggy when they get home, but they're able to eat and walk, and they're acting quite normal just a few hours after the procedure. So if you have any questions or if you'd like to set up an appointment to talk about whether your pet needs to have a dental cleaning, please don't hesitate to call or email. We're here to help and always happy to answer questions.